Good evening, everyone. Welcome all dear participants to this second session of Autism Management Series. So today we are going to talk about understanding the brain and behavior, the connection between the brain and behavior in autism. I hope I am audible.
Yes, doctor, you are audible.
Yes, Dr. audible.
Thank you. Thank you. So the foundations of brain and behavior. We understand, we all know that in autism, the major challenge area we struggle on day-to-day basis is behavior. So now where from this behavior is coming? Why the behavior is different in autism? That's what is the motive of today's session. So initially, I'll present few slides. I'll give you some information about the relationship between brain and behavior in autism. And later on, post completion of the slides and presentation, we will be open for question and answer. So you may keep your questions ready. Post completion of the slide presentation, I will give you enough time for all your questions and answers. So the foundations of brain behavior. The brain works as a command center in our body. So our whole body, its movement, its functions are controlled by brain. And behavior is the brain's output. Every thought, feeling, and action originates from the neural processing. So in the last session, we were seeing people who have joined today who were not there in the last session. You may follow my YouTube channel or you may ask for the recorded links. And you may also request the admin of JKP Care Foundation to add you in the WhatsApp group where we share the recordings and PPT and related study material. So even our thoughts, feelings, and actions originates from neural processing. Last session, we had seen what is neural processing, the communication, how neurons communicate with each other in the brain. So today, let's look into the key brain parts. I will not go more into detail because it's the parent-specific session, and I don't think that we need to go much into the technical terminologies. But in short, brain has these four major parts: cortex, limbic system, cerebellum, and brainstem. So the cortex is responsible for thinking and decision making, controlling higher cognitive functions and reasoning. I'm connecting it to the behavior. That's why I'm just mentioning in this. Limbic system regulates emotions and memory. It plays a vital role in emotional response and social interactions. Cerebellum coordinates with movement and balance, essential for physical activities and fine motor skills. And brainstem, the brainstem's primary role is to control essential automatic functioning of the body, functions necessary for survival, such as breathing, heart rate, blood pressure, swelling, all those functions. So now all these parts communicate with each other in making a decision or in giving a command to the body or in, kind of reflecting as behavior, reflecting as our emotions. So everyday connections, our brain constantly shapes how we think and act. For instance, stress can cloud our judgment. So if we are stressed, our emotional part is burdened, then our judgment logics may fail or may get interrupted because all these parts coordinate with each other and integrate with each other in decision making. So leading to impulsive decisions. Recognizing these connections helps us to understand the profound impact of brain activity on our everyday interactions and choices. So how brain shapes the behavior? First thing is neural communication via neurotransmitters. So in our brain, we have neurons. Last session we were discussing about it. And these neurons communicate with each other. So the communication channels are developed by, connected with each other by neurotransmitters. Then sensory inputs, processing and motor outputs that affects our behavior. Integration of emotions and cognitive responses gets clubbed with this neural activity and that shapes our behavior. So these are the three major components of behavior, how it's being shaped. So if we look in a little bit of detail, neural communication via neurotransmitters. Every behavior starts with neurons talking to each other. Neurons usually use chemical messengers called neurotransmitters like dopamine, serotonin, GABA, and glutamate to send signals. Imagine billion of WhatsApp groups. Nowadays, we all are there in WhatsApp groups. So billion of WhatsApp messages are sent every second between the brain cells. Just trying to relate and visualize that there are not hundreds, not thousands, but billions. Billions of messages are being sent. That's neurotransmission. And when messaging slows down or gets mixed up, like this message was supposed to go in this group, but it goes instead of this group due to overload, due to overpressure of work, it gets mixed up with some other group. So then behavior change occurs. A typical neurotransmitter activity may affect motivation, attention, and social interest. So if the neurotransmitter activity is hampered, it is getting mixed up with the other neural activities, so then it affects motivation, attention, and social interest. All three have deficits or concerns in autism behavior. So motivation, attention, social interest are the major concerns which we see, which reflect as autism behaviors. So these neurons communicate using electrical and chemical, two impulses. Electrical is the action potential and chemical are the neuropotentials. So electrical is what? There are three different, you can understand different electrical voltage that communicates, that carries the signal along with the chemical. Together they carry the signals from one neuron to another neuron. And this is how the neural communication gets distorted or difficult in autism. Common brain differences in autism are connectivity, sensory processing, executive functioning, social communication, and repetitive behaviors. All those differences do reflect and impact the behavior in autism. So individuals with autism often experience connectivity differences affecting how brain regions communicate efficiently. The integration of all brain regions, how do they communicate with each other, that gets hampered in autism. Sensory processing, whatever input we take from our senses, from our environment, that input gets processed. And then you give your output. Now imagine you are watching a movie on an audio visual, like a cinema hall, you go and watch a movie. There is some pictures going on, visual input, and there is some audio input also. So you look from your eyes and you hear from your auditory senses, from your ears. Now, there are neurons who capture the signals from eyes, send it to other neurons. There are neurons who capture the signals from your auditory system, send it to other neurons, and then they coordinate, they integrate. Then only you are able to connect with the movie. But if there is a delay in either of it, suppose audio is delayed, visual is working perfect. Now, you'll not be able to relate with that movie because you'll see the picture, you will get the audio little later. So when it gets like, this is how, it's not only about audio visual. I've just given you an example of cinema hall, but it is with all the senses, your tactile, your touch, your taste, all the senses. When there is a processing delay or sensory processing disorder, which is there in 96% children with autism, often face sensory processing disorder. So that reflects into behavior. Executive function. Challenges in executive function may manifest as difficulties in planning, organization, impulse control, and that again reflects into your behavior. Then social communication. Social communication difficulties can include challenges in understanding nonverbal cues, engaging in reciprocal conversations. So children with autism, they face concerns with mirror neurons. We will be discussing about them in the further slides. So they don't understand, at times they don't understand expression or others' expression. They don't understand the emotions, theory of mind. They don't connect with others' feelings, or they are not able to replicate. Replicate, suppose, replication in the sense other activities, actions of others, and that hampers with their learning and behavior. Then we have the repetitive behaviors. To settle down without regulation, to regularize themselves, they have repetitive behaviors such as routines, rituals. Often you see the discomfort in children or adults with autism. They find it difficult due to the repetitive behaviors also. Their behavior patterns are different. So these are the common brain differences which we find in autism: connectivity, sensory processing, executive function, social communication, and repetitive behavior. Role of sensory input and processing and motor output. So input, processing, output. This is a chain. Input is from all our senses. Like I gave you an example about the audio visual. So from our senses, all senses, we collect the information from sound, from touch, from sight. We collect information. Now this information brain interprets and makes a meaning of it. Output is the behavior. So brain processes this information, interrogates this, and then makes a meaning of it, then decides the behavior. So behavior is the outcome of the sensory input test, sensory processing also. That is also important to look into. So if a loud sound occurs, suddenly if there is a loud sound, the ear captures the input, the brain labels it as threatening. There's a bomb blast, there is something has happened. And person covers the ears or cries. That is the output. So as soon as I hear a loud sound, body's first reaction is to cover. So this is happening through this neural activity, the communication, neural communication, through neurotransmitters or whatever we are communicating in the brain. It happens in nanoseconds. It does not take much time. But in autism, when there is a sensory processing delay or sensory processing disorder, this whole cycle, the whole chain gets interrupted. And that reflects in our behavior. So the pathways of sensory processing are: brainstem filters sensory signals, integrates across visual, auditory, tactile inputs, and overload becomes behavioral response. Meltdown, avoidance, the behaviors which you see are the outcome of sensory processing. So if there is overload in the sensory system, then that's the reason you see in children with autism, they often close their ears, or they go into spinning, or they go into some repetitive behaviors. By doing this, what they are doing is basically they are trying to, they close their eyes, they are trying to limit the sensory input. If too much of information is coming, I am not able to integrate that information. I'm not able to process that information. What I will do is I'll slow down the input so that the processing gets its own time, and then I will give my output. So the behaviors which you see as self-regulatory behaviors are usually to slow down the sensory. So sensory information is processed and filtered. In autism, filtering differences lead to the hypersensitivity or hyposensitivity. Either or. Either it is hyper or hypo. Children with autism may process sensory input too intensely or too weakly, leading to visual behaviors responses like stimming or avoidance. So these are also the outcome of the sensory processing differences which we see in children with autism. Third factor which affects the behavior is integration of emotional and cognitive responses. So first is your neural communication we have seen, sensory processing we have seen, integration of emotional and cognitive responses. The thinking brain, frontal lobe and cortex, and the emotional brain, limbic system, constantly interact with each other. Emotions color the decision making and reactions. Now, have you ever realized your productivity goes down when you are emotionally low or when you are under a lot of stress? Why does that happen? Because the limbic system, which is called to be emotional brain, which looks into the emotions, is coordinating with the thinking brain, the cortex, front lobe. Now, what happens is when your limbic system is overburdened and is not able to connect and coordinate properly with the thinking brain, the emotional brain and thinking brain are not able to coordinate with each other. Then you find overload of emotions, and that reflects into your behavior. If we see an example of a child who feels anxious because of bright lights, not able to think or follow instructions. Bright lights is sensory input, but because of bright light, child has gone into anxious stage. And with this anxiety, this anxious stage, the emotions overrides the logic, overrides the frontal lobe in cortex, thinking brain, and child is not able to follow your instructions or not able to think. In autism, this integration can be less efficient. Emotional overload can interrupt reasoning and self-control also. So these are the three main areas which we have looked into just now. I will take you back to the screen. Neural communication via neurotransmitters. If it is distorted, then behavior gets hampered. Sensory input, processing and motor outputs, and integration of emotional and cognitive responses. Because of this, you see the different behaviors in children. What are these behaviors telling us? So when we look at a behavior, we are really looking at how the brain has processed the world, not just what the child has chosen to do. What child is exhibiting as behavior, we often concentrate on that and we start giving instructions. No, don't do this. Bad behavior. You are a bad boy. All these instructions, what we give, goes unnoticed. They go unnoticed. Child is not in frame to take instructions from you at that time because there is something happening in the brain. Either the emotional overload, sensory processing concerns, or the different neural connectivity. Behavior is outcome of that. So we don't have to start working on behavior by correcting behavior, but we need to go for the core concerns, core areas. These three areas, we need to work on them to get the better behavior output or the socially acceptable behavior output. In fact, we should appreciate how children's bodies and brains use behavior to help them manage their surroundings and their experience of being in the world. So instead of shouting at them, instead of punishing them for behavior, we should appreciate, we should understand decode the message and appreciate it, how they are trying to coordinate with the world, with the input and giving their output. Now, if we look into the brain development at the childhood age, last session also we were discussing about it, early intervention. So in childhood time, early plasticity is there. During early development, children's brain exhibit remarkable plasticity, allowing for adaptation and learning. So plasticity is what is the brain plasticity? That brain adapts to new things very fast. So we have early plasticity. Child, if we give them kind of inputs we give them on basis of their experiences, on basis of their environment, they create new patterns. They learn and brain develops on basis of that. And then symptom presentation. Symptoms in children may vary significantly, often reflecting changing developmental stages and social context. So in the early childhood, you might see different symptoms and behavior. Then when they go towards the adolescent, transition and adolescent, you will see different patterns of behavior. When they become adults, you will see different. As per in the adult age, brain changes at the brain, we see the brain maturation. As the adults with autism age, their brain continues to develop. It is not that brain is not developing, not learning from experiences and environment. It impacts the behavior and social skills. But many adults develop effective coping strategies to navigate daily challenges and improve social interaction. So at childhood stage, coping strategies are less, plasticity is more, grasping is more. But at adulthood, Coping strategy. Brain starts thinking and managing with the social settings, with the expectations, in social expectations, and start controlling their emotions. So neuroplasticity and learning. The brain reorganizes with experiences. Learning changes neural connection. So more they learn at the early childhood, because neuroplasticity is more at the early childhood, the new neural connections are formed easily. Early intervention builds the lasting brain changes. We have seen that early intervention, why it is important in the last session also. So the neurotransmitters, the chemical part of it, are majorly four: dopamine, serotonin, GABA, and glutamate. So dopamine is responsible for motivation, serotonin is responsible for mood, GABA is for calming, and glutamate is for learning. So chemical imbalances. If in autism we find there are chemical imbalances also. So the chemical imbalances affect mood, attention, and behavior. If motivation is not there, mood is like serotonin has some deficits or some concerns, then mood or calming, they don't get calm easily, or the learning gets it. Ultimately, it affects mood, attention, and behavior. What is the connectivity difference? We have seen in the last session also, I guess, this, that typical brain has set patterns of neural connectivity, but that those patterns are developed in a formal way from our experiences or learnings which we get from our environment. But in an autistic brain, there are some communications, some connections which are built up differently. I will not call it wrongly, but differently. So in the image, if you see here, in the red lines which we have shown are the differently built neural connections. So for an example, if you see in some region, there are so many short roads, but few highways linking distant regions. So in a country or in a city or in a village, there are short roads and there are highways also, but there are many short roads. Highways are very less, leading to a strong detailed memory, but weak global understanding. So local overconnectivity and long range underconnectivity. So local overconnectivity brings too much of details to focus. But autism has local overconnectivity. That's why they have too much detailed focus. And long range underconnectivity, poor integration is the outcome of long range underconnectivity. Less of the highways, more the short roads. Affects communication between brain regions. So when the brain regions, all of these which we have discussed now, they have to communicate with each other. Long range interconnectivity affects, local overconnectivity also affects. And that results into output, that is behavior. Then in autism, we also have the concern of mirror neuron system. Now let us look into what is mirror neuron system. If I start yawning now, or if I start laughing, have you ever experienced this? That you see somebody who's yawning and you start yawning, or you see somebody who's laughing, you don't know the reason, but you also smile or laugh. That is your mirror neuron system at work. So we have some neurons in the brain which are called mirror neurons. They are the special brain cells that fire both when we perform an action and when we observe someone else performing the same action. So we copy. The neurons mirror the other person. So they act like brain mirrors, helping us to understand others' emotions and intentions through observation. Now, they create mental stimulation of others' actions, a foundation that is required for imitation, empathy, and learning through observation. Now, in autism, we find that mirror neurons are limited. That is the reason children with autism find it difficult to imitate, to have empathy for others, and to learn from through observations. So studies show that individuals with autism often have reduced activation of these mirror neuron regions. This means It's harder for them to automatically understand what others are feeling or intending. They may not imitate gestures, facial expressions, or social cues as early. Imitation-based learning, a key development process, is slower or less spontaneous. We start learning from our sensory system when we are in early childhood, infant stage, 0 to 1 year, we start learning from the sensory system. And then we go into the imitation stage of learning. It's a development process. But when mirror neurons are lesser activated, that time in autism, children find it difficult to imitate. Children find it difficult to understand through your gestures. They find it difficult to understand empathy. So in other words, if I say the brain mirrors are present, but not reflecting as brightly. So they are present in the brain in autism also, but they are not reflecting as brightly. They may need more conscious efforts to read other. I would just request you to mute. Yeah. So behavior manifestations in childhood. How we should understand the behavior. Meltdowns are not tantrums. Fixations towards light, fans, and different patterns. Repetitive play is for self-regulation. And they have difficulty with transitions. These are the common behaviors which we see, but often we assume meltdowns as tantrums. In autism, meltdowns are not tantrums, they are behaviors. They are trying to communicate something to you. We need to decode that communication and understand the behavior. When we see behavior that is problematic or confusing, say socially not acceptable behavior, the first question we should ask is not how do we get rid of this behavior? Many parents come to me and ask me, oh, child is doing this behavior, how to get rid of? But rather, we need to focus on what this behavior is telling us about the child. Behavior is the reflection of how child's brain is processing. So we should read what the behavior is telling us instead of concentrating on how to get rid of this behavior. Once we decode the behavior, we understand what child is going through, how child's brain is processing. We can definitely work on behavior modification plan. As children develop, their brain mirrors the parent's brain. In other words, the parent's own growth and development or lack of those impact the child's brain because child is spending the maximum time with parents. So as parents become more aware and emotionally healthy, their children reap with rewards and move towards health as well. So we need to work. That is the reason we have started this series also. We need to educate parents. We need to work with their mental stress. Once they are stress-free, they are more healthy emotionally, they can fill the cup of their children. In conclusion, understanding to support. We need to understand to support. Behavior is just an outcome of what is going on in their brain. So brain differences explain the behavior. Understanding leads to empathy. Different, not less. So children with autism, as per Temple Garden, an advocate and a person with autism, says that children are different in autism. People in autism are different, but they are no less. I encourage all participants to see behavior as communication from a differently wired brain. So each behavior, you should read it as communication, what they are trying to communicate. Instead of correcting the behavior, our focus most of the time is on correction of the behavior. Instead of correcting the behavior, our focus should be on decoding the behavior, what child is trying to communicate to us by this behavior, and how we can fulfill that need. With this, I will just end this presentation, not much to discuss in this in detail. We are open for the question answer. If anybody wants, we have a special behavior modification training, which is a 1 month training program, 16 hours of live training sessions, where we talk about behavior modification, the strategies, the techniques, the principles in detail. So to promote awareness and support, we are doing this webinar series of 12 weeks. Every week we will come up with the short lectures, and post lectures we will have the question answer sessions. I appeal to all of you to kindly support this mission to create this awareness. I have mentioned in this PPT, this will be shared with you. The QR code is also mentioned here. You can go to our website, jkphealthcare.com/pay, on the link of pay and donate, or you may go to jkp.ngo. You may also subscribe to our YouTube channel, my personal YouTube channel, not JKP's, and all the videos, more informative sessions are there on behavior modification. I have 2 lectures which are there in detail for, I think, almost for 2.5 hours together. So you may go for behavior modification 1 and behavior modification 2. YouTube links I will share with you all in the WhatsApp group also. I'll ask the admin to do that, and you can go through for the behavior modification. From today's session, I just wanted you to understand that behavior is an outcome of what is happening in the brain. To modify it, you need to understand, you need to decode the behavior. Directly, we don't have to, start working on behavior or start correcting. That's all. I'm open for the questions. Thank you. Thank you for listening to me. The previous session, I received the feedback. The slides were too lengthy and people got less time for the question answer. So this time I have kept the content limited and I'm open to the questions. Okay, I'm reading the chat now. Sir, did you create a WhatsApp group? Yes, the WhatsApp group has been created. I will ask you, I'm just mentioning my contact number here in the group. You may WhatsApp me and I'll send you the WhatsApp group join link. So people who are not there in that group yet, you may please connect with me. Just send me a request that you want a WhatsApp group join link. I will add you there. So every series, we will share the recordings. We will share some PPTs, some reading material also in the WhatsApp group. I have also written a book, compiled a book on understanding autism from parent perspective in very simple words, no technical jargons. I can share it with you. So you all can, in the WhatsApp group, I've already shared, but if anybody wants that, the book is called Spectrum of Hope, Understanding to Autism. So you may just send me a request on WhatsApp. I've shared my number in the chat box, and you can take a copy of ebook and read it. May I know what is the transition in autism? Transition from, there are 2 types of transitions. One is daily activity transition. Another is age-related transition. As the brain grows, we go as per the age, the mental age I'm talking about. Children go into adolescent. From adolescent, we go into adulthood. And each stage of life in autism has its own challenges. When we talk about autism, I think most of the time, almost 70–80% of the time, we are talking about children, pediatric cases, children, autism. But it is not only children. These children outgrow. They become adults, adolescents, adults, and they also grow old. So they have different challenges, different expectations, social expectations. And we need to manage autism as lifespan. That is why this series we are covering up topics one by one. In last session, we saw the early intervention. Now we are seeing the behavior and brain development and behavior. And further series, we'll be seeing more topics related to the adolescent, related to the adulthood and the old age challenges. And we'll work on each of them. So that is one transition. Second transition is daily activity transition, daily challenges and transition from one activity to another. So transition from your home to school, from school to home, or from one activity to another activity. So they change, shift over. Children with autism find it difficult to transit, be it the age related transition or be it the daily schedule transitions. They don't understand the predictability. They do not know what is going to happen next. Sometimes I have seen in some children, they exhibit behaviors because their brain processes in present that whatever is happening now will continue forever. So if I'm doing an activity with the child feels, and child is not enjoying that activity, suppose, then the child feels trapped in that activity. And there is no end to it. Child does not know when this activity will end. What will I do next? That's why scheduling is very important in autism when it comes to managing autism. Giving a brief to children. What is going to happen next? We are going to the therapy. We will have therapy for 1 hour from 3 o'clock to 4 o'clock. 4 o'clock, mama will bring you home. And at home, we will have playtime. That input needs to be given to the child on a regular basis. So then the transition becomes smooth. Or we are doing this activity only for 10 minutes. Post 10 minutes, this is the reward waiting for you, or this is the another activity waiting for you. So that, in the transition, that is very important to inform. Dr. Kanchanpur is asking how to control repetitive behaviors in autism kids. My dear doctor, we don't have to control any behavior. Repetitive behaviors is an outcome of brain processing, self-regulation. So we don't have to control a behavior. We have to work on the underlying cause of the behavior. So we need to self-regularize. We need to regularize those children. We need to give them opportunities like giving them the sensory breaks or giving them sensory diets so that they regularize this. So we don't have to work on on controlling any behavior. We need to work on the underlying cause or concerns why this behavior is happening. Poonam Dua is asking, sir, do you take counseling sessions also one-to-one? Yes, I take online counseling sessions and consultings one-to-one. I do assessments also. You may connect with me. I've already shared my WhatsApp number for that. Dr. Kanchanpur is asking, autism kid have to do every activity in a sequence. If I change anything in that activity, that kid behavior suddenly change and he starts shouting. How to break this sequence? Yes, scheduling. It is very important. Autism children want to do things in schedule because related to the earlier question also, because in sequence they know this is first, this is next. So they don't get into trap that this is going to end forever. Now, when you change the activity, change the routine, they feel discomfort because they find the linear system, something is missing. So every morning when you wake up, you go to the washroom, you wash your face, you brush your teeth, you do toileting, you take a shower, come out, wear your clothes, change your clothes, like get into the new clothes, you wear your clothes, and then you go for your breakfast. That's the routine if you follow. What if someday, I'm not talking about autism, I'm not just asking you as an adult. What if someday you wake up and you directly go for the breakfast? You will feel discomfort because your pattern is disturbed. You are following a set pattern, or you are directly asked to change the clothes, but without shower, without washing your face, or without brushing. You will feel uneasy. That is what happens with these children. So they understand the linear. For us, we understand to accommodate with the environment. Someday I know that I have to rush for work. This happens with all of us. I don't have time. I woke up late. I don't have time for taking shower. What I do is just wash my face, change my clothes, get into the clothes and rush. Sometimes I skip my breakfast. On the way, I just have something and munch. This we understand with our brain processing, our emotions, our understanding of the environment and prioritizing things. But children with autism do not relate. That is why they follow a linear pattern. Now, this is a circular pattern, which I've told you. Linear is you go in a straight line, step by step. And circular is you miss out something, you jump to the next one. You miss out something, jump to third one. I am in a meeting. Meeting has prolonged for 2 hours, 3 hours. My lunchtime has passed. Okay, I directly jump to the evening snacks. Or maybe I take my lunch after the meeting completes. But children with autism, they follow the linear pattern. Because of this linear pattern, they find it difficult to change in the schedule. But it is important to teach them the change in the schedule. Generalization is the key. We need to generalize their patterns. Yes, it is easy to give them a fixed routine. Most of the professionals would advocate that we need to give them fixed routine, we need to schedule, they are more comfortable. I understand. I agree with it. At the initial stages, let us give them a fixed routine, fixed schedule, but with time, because world is not certain. They have to outgrow. They have to become an adult. Then they have to face the social challenges. Everywhere they will not get the set patterns. We are not able to create a system where everywhere they go in any environment, they will get the set things, step 1, step 2, step 3. So what we do is we teach them to generalize. We teach them to understand that sometimes it's okay to miss something and go skip to the next one. With visual cards, we teach them the scheduling. It makes easy for them to understand at the early childhood, and later on we give them the strategies, different strategies of behavior modification, where we are teaching them to skip in on the routines, to generalize, to manipulate with these routines. So how to break this sequence? Now you need to break this sequence. First thing is give them the sequence, let them learn through sequence, because their productivity is better, their learning is better when they are following a particular routine or sequence. But make these slow shifts in the sequence, slow changes. Don't eliminate the whole step. Your your activity. So you do not skip the entire sequence. Just skip one part of it and teach the child it's okay to skip that today because we have less time, and jump to the next one. Start with the favorable activities which they like and the activities which they do not enjoy much. So skip the ones which they do not enjoy and jump on the ones they enjoy. So automatically, when they jump from one to the other one, miss something that they do not like it much, they will be more comfortable. They are okay with it. Slowly go towards all the activities which they like or dislike in the linear position, and start skipping something in the routine. That is generalization. Okay. Pooja says, sir, sensory diet means you just told about sensory diet. Sensory diet is, it is a routine which we create. We, as in not me, but the occupational therapists usually create this, or sensory integration professionals. So they create the sensory diet, whatever is the sensory input child requires. They provide that input pre-hand in the daily routine. So they create set of activities like jumping on trampoline, listening to some music, or you're giving activation through some visual environment to the child. All that is set, all that is given to the child as per child sensory needs, or in shorter breaks during the daily routine. So in an activity session of 35 minutes, I give 5 minutes sensory break. Sensory break becomes a part of sensory diet. So it is nothing to eat. Diet usually we assume with eating, but no, it is something to do with the sensory needs of the child, whatever are the sensory needs. So occupational therapists are the one who are trained on it usually, and they create the sensory diets for the children. Those sensory diets are given to parents who can incorporate that routine within their daily routine. It's not an additional burden, but within daily routine, jumping on trampoline or running activity, or some other activities which can provide the sensory audiovisual sensory input, keeping the child in sensory room for 5 minutes, or giving the audiovisual sensory input. All of this is part of sensory. Pooja, I hope I have answered. If anybody has further questions, you may unmute, you may speak, not a problem. So you may unmute and discuss with me, you may speak also. Okay, Kolal has already mentioned it's a sensory plan. Yes. Can neurotransmitters like GABA, serotonin, etc. can be assessed in child since it can lead to behavior problems in children? Yes, it can be assessed. There are typical tests to do it. it can be assessed in the children. But we need to activate them by not by medicine, but by inputs. We need to give them the inputs. In behavior, we do not, as a clinical psychologist, as I practice, I do not focus on the chemical intake, but on the therapies. So with the therapies, with different activities, we can definitely work on the different chemicals in the body. With dopamine, serotonin, we can always work on them. Like meditation will increase the GABA or serotonin levels. Some jumping activity will increase some other chemicals. Eating chocolates, eating sugary products increases dopamine. So we work more on the therapies than the chemical intakes. Nilambri says, what are the activities that we can take to reduce high auditory sensitivity? Nilambri, if the child is high on auditory part, we need to slowly expose them to the auditory environment. Okay. You can, to provide support immediately, you can give them the earplugs or the noise cancellation headphones. That is the immediate support. But in longer run, we need to develop the immunity towards louder noise. How it develops? Suppose you live in a village which has very calm atmosphere, lesser the crowd, lesser the people, lesser the sound, lesser the traffic. Suddenly, you are shifted to a big town, a metro city, near to the railway station or near to the airport, where you have so much of trains and aeroplanes landing and noise. Lot of traffic, near to traffic signal, you are staying somewhere. So that starts disturbing your daily routine, isn't it? Initial levels, you face it very difficult. But once you start living in that environment for a longer period, you start ignoring that sound and you start living your life normally. So people who live in this traffic areas, high traffic areas, or in the near to the railway stations or near to the airports, they are immune to auditorily, they are immune to the higher auditory. So slowly, with the right way of exposure, we need to work on reducing the high auditory sensitivity. But we cannot wait for that, that tolerance to come. That tolerance may take several months. You do not have to expose the child to the environment, the higher end of the auditory environment immediately. So what you need to do is start with earplugs, go with noise cancellation headphones, then slowly move towards the cotton, and then slowly take them off, expose the child slowly to the new environment, to the higher auditory. So environment, and child will be comfortable. It's like, again, another example. For the first time, when you go to a discotheque, a disc where you have a lot of noise, or a movie, or a marriage function, or a dance party where you have a lot of music and sound, you feel, after some time, you feel headache. But think about people like DJs or the people who work there as service people, who catering staff. They are daily exposed to that environment. So their immunity has developed to that. So for auditory, we need to slowly expose the children and develop that immunity. It takes time. It may take several months or sometimes years also. Usually, I have seen the changes within 7 to 8 months, but with the slowly increasing volume. So what we do is we provide them the music therapy, where we start with very slow and slowly increase. When they are involved in the activity of their preference, we give the auditory input from the background, continuous auditory input. In my therapy center, we used to run, not now, because now I'm not into clinical practice anymore. So in my therapy center, we used to have the music in background for the children who have hypersensitivity towards auditory system, to develop the, but music on a very slow pace, slowly increase the volume. And especially in condition when child is involved in the favorable activities, in activities of their interest. So slowly they start ignoring it and start developing the auditory coordination. Shreya says, doctor, how to calm an emotional kid who starts banging self and cries, also looks for emotional support. Now, we need to do an ABC analysis of this behavior of self-harming, banging self, and crying. Definitely, there is a trigger why child is doing it. If you start writing on a daily basis for every behavior, you should start doing that. So if you start writing what has happened, how child reacted, not your assumptions that child was sad or child was angry. No, just the reaction, what you see, in what you observe in the behavior. As you have mentioned correctly here, banging self or crying. How long did it happen? What had happened before the behavior? What was the need to do this? What could have been a reason to do this? And how did this behavior settle down? Like child wanted a candy or an ice cream. I refused to give candy and ice cream. Child started self-hitting or crying. Then I gave the ice cream. I bought the ice cream and gave to the child. So in this behavior, if you want to write down in ABC format, ABC is antecedent, behavior, and consequence. Antecedent, what happened before the behavior? Behavior is what was the behavior which you observe, which you can see physically, and consequences, how did the behavior settle down? You start doing this behavior analysis by ABC, definitely within 10 or 15 days of repeat, when you see this behavior, same behavior repeating, you will reach to conclusion why this behavior is coming. So you need to understand why child is banging herself. So banging self or crying may not necessarily be related to being sad or being disturbed. Children may hit others or children may hit themselves just to demand something from you. And it could be the outcome of the neural communication which they learned at very early age. Initially, at very early age, when child wanted an ice cream, you didn't give the ice cream, and the child cried and started hitting himself. You gave the ice cream. Now the child has registered this. Multiple times this happened. Child registered this. There is no use of asking for ice cream. If I want an ice cream, I need to exhibit this behavior. So behavior is a communication. So by doing, child is learning this as a communication. That if I do this, if I hit myself, or if I start crying, that means I will get an ice cream. So if I want an ice cream, I can tell you, please give me an ice cream. I can say in the other language also. I can say in Hindi, ice cream de do. I may say in Marathi, I may say in other language. The same way, behavior is also a language which children pick up in autism, and they speak to you in their behavioral communication. That is what I was mentioning. On YouTube, I have 2.5 hours session, 2 sessions divided part 1, part 2 on my channel that are for behavioral communication. Please send me, people who are there in the WhatsApp group, I will ask the admin to share there, but anybody who wants to see that, please send me a WhatsApp text on my number. I will send you the links of those behavioral communication. You will understand it better. And through behavioral communication, you will be able to solve this problem. Okay, Shreya? Let's go to next question, Anish. Doctor, how to make a plan for auditory processing disorders? Now, for auditory processing disorders, we need to first understand whether it is hyposensitivity or hypersensitivity in auditory and make a plan accordingly. So first, understand is either it is hypo or hyper. Go for a beta testing if you have not done that. It is compulsory nowadays too. Whether hearing is impaired or not. Very rare cases in autism, we see hearing impairment also. Not on all cases, but very rare cases. So sometimes we assume it is auditory processing, but whereas it is hearing impairment. So I have seen it hardly in 1 to 2% children in autism, not more, hearing impairment. So we need to provide them support with the hearing aids also. And then slow exposure to the environment, auditory process. with the experience, with the environment, our neural connections are being built. We have seen in the slides today also that our neural connections get built with the experience. Repetitive experiences, stronger the neural connections are. So give them the repetitive experiences, it will work. Next question. Hi sir, can some random perfume smell or particular flower smell trigger a meltdown in a child? Yes. Since I said sensory inputs, so if a child is auditorily hypersensitive, ear. Visual hypersensitive, the eyes. The colors may affect the mood. Colors may bring the meltdowns. Similarly, smell. There are some we all also do not like. Sensory processing concerns are there in all of us, but the degree may vary. We like some particular smells and we do not like some particular smells. But the other persons are immune to that smell. A pure vegetarian person who has never been exposed to an environment of frying fish. First time when fish is being fried, even the person is not visually seeing it, but the smell coming from the other house or from a restaurant or from a kitchen can disturb them a lot because they do not like that smell. But whereas people who eat fish, who fry fish daily, they are immune to that smell. So sensory processing difficulties are there with all of us. So in smell also, we have hypersensitivity and hyposensitivity. So yes, the random perfume smell, not all perfume, but the particular smells or flower smells can trigger a meltdown in a child. If a child is not comfortable with that, it can trigger a meltdown. The solution is the same, slow exposure of that smell. As long as it is not bothering much, let us try to eliminate that perfume from our. Immediately what we need to do is those flowers or those perfumes which child is not comfortable with should not come in my child environment. But for a longer duration, I'm talking about lifespan management. You can control the environment at your home, but when child will grow, child will go to work. How would you control that the other colleague is not wearing that perfume smell? When child is traveling in public transport, how would you control that some other person is not carrying the flowers, those flowers which are bothering my child, and the meltdown will start there. So slowly with time, we need to work on this sensitivity with slow exposure of the same smell, dilute it to the minimum, put it in the environment, not directly, indirectly, when the child is involved in some favorable activities, enjoyable activities. So let it go as a sensory input, unknowing sensory input, not the direct sensory input, but indirectly let it go as an. And child is involved in the interesting or favorable activity, child may tend to ignore it. From there, child will pick up the ignorance towards this smell. And slowly, the concentration of the smell increase. But go very slow, bit by bit, from dilution to the increase. How to plan for learning disorder? Now, what do you plan for learning disorder, Chitali?
हाँ सर
Yeah, hi. Tell me.
सर मीट है ना 10th स्टैंडर्ड में है और इसके लिए मुझे कुछ प्लान चाहिए था कि वो एग्जाम में थोड़ा इजी करके आ सके क्वेश्चन आंसर वगैरह कैसे कराऊं उसको
Chaitali, for this, I would ask you to send me a text. I will connect you with Dr. Dagi P. Sinha. She is a special educator with us in JKP Care Foundation. She is the director for special education, and she will be the. She is the right person. She is a very senior professional, retired principal from B.Ed Special Education College in Goa, 27 years
Okay.
plus experience. So I will connect you with her. She will be able to answer your question. This is how not in the my curriculum, so I'll not be the right person to answer this. Okay, since it is related to the educational part, a special educator may help you better. So you just text me. I will share the number of Dr. Gargi, or we'll book an appointment with her, and she can connect. She can answer you better. Okay.
Okay, sir.
Sir, how to help with verbal stimming? Pooja. So Pooja, please tell me, unmute and tell me why verbal stimming is happening. Let us look into, just observe the behavior, verbal stimming, but what is the core reason for verbal stimming? Pooja, you're there. Can you please unmute?
Hello, sir. I'm
Yes.
Pooja.
Yeah.
Whenever the baby is focusing something, he will have a verbal streaming. So how could I help him for that? Sometimes if I call his name, he will just stop it. But I just wanted to know, is there any therapy of something like that for helping
Okay.
for verbal streaming?
Okay. What the child is doing in verbal stimming? Tell me that.
He will just regulate himself with flapping his hand, like just regulating himself.
So child is trying to regulate. So
Yes.
we need to, so we need to give opportunities to the child. You have the answer yourself. You already have the answer. Why verbal
Yeah.
stimming or any sort of stimming is happening for self-regulation.
Yes.
Now, when the neurons are, we have seen three in behavioral thing, we have seen three components. One is the neural activity. So when neuron communication, neurons are finding it difficult to communicate with each other, or when sensory input is too much. So they are finding they want to take time to do the sensory processing or neural communication. What we do is we self-regularize ourselves by way of stimming. Stimming could be in many ways. Could be verbal stimming, could be hand flapping, could be spinning. All of this could be for self-regulation. Okay, it is like when you ask someone if there is an interview going on. I'm just giving you a live example. You might have seen during the podcast, during the interviews, or during some press conferences, the people respond in a way. If I ask a question, they will respond. Just a minute. So if I ask a question, they will respond, "Oh, that's a great question, very relevant question. Oh yes, you are right." Why they do this? These are the pillars they use. Why these pillars? To regulate. Every question is a good question, but I don't say on every question that it's a good question. But to some questions, I say, "Oh, that's a good question. That's a great question. That is very relevant." Why they say this? Because the brain needs time to process that information from the memory or from the cognition. They need to link with each other. So in those events, when we want a little bit extra time for brain processing, we just use some fillers. And that is stim. So when I want to close my input, extra input, and when I want to just give time for my brain to process, I do the stim. So yes, for stimming, we have the therapies. We suggest not to work much on stimming until and unless it is bothering the development.
So is it
So if
okay,
it is
sir?
bothering the development of the child, we should start working on it. But if it is not bothering the development of the child, let the child self-regulate himself. Let us give him some time zones to self-regulate also. That is like shutting down your Windows, your phone, or your computer and restarting. So giving time to process, giving time to retrieve the information, or giving time to coordinate, to integrate all parts of brain. So to give that time, what they want to do is they want to cut short the input, because 24/7 we are taking either auditory input, visual input, and smell input, your tactile input, the touch also. So we are taking the inputs from our senses 24/7. And that input is going in neurons, and neurons are busy activities. Consider neurons are talking to each other. This neuron is running here, giving that information. Now this is coming from through neurotransmitters. They are sending this information here, this information here. Lot of activity happening in the brain. And there comes a time when I'm like too much, and then I do this hand flapping, or I do spinning, or I do verbal stimming. I start repeating things. I start, singing songs, or some music, some sound, I start making sound. By that, what I'm doing is I'm closing my sensories, I'm closing my input, I'm interrupting the input so that I don't hear other voices, so that I don't get more input and let the information process. Once it settles down, I do this more. So if a child is doing verbal streaming, then it means the child has sensory processing difficulties. Let us provide the sensory diet to the child. Streaming reduces. It does not go away, it reduces. Okay?
Okay, thank you, sir.
Ranjita says, what type of music or sound should be given to the child having higher sensitivity to the noise? Ranjita, on my channel, I have one autism tunnel that is for the visual and audio for calming down children with autism. You may start with that. And then identify what all are the sounds that are bothering the child. It's not all the frequencies that bother to us. Maybe the pressure cooker whistle, maybe the motorcycle sound, maybe the mixer grinder sound in day-to-day activities, which all are the frequencies that are bothering more. Slowly expose the child to those frequencies. You don't have to give much of the input, but start with the little lesser and go for the higher. Yes. But you may start for calming down if a child is very hyperactive. Autism music tunnel really helps for the sensory processing difficulty children. So you can calm down with that audio visual input. Yes, Kolal also has mentioned calming music, natural music sound like rain. Yes, that helps a lot. Okay, thank you, thank you. Abhisha says, sir, I need to inquire from you that my child having too much problem with hair cutting. Yes. Children with autism, many of them have problem with hair cutting. They get distressed with hair cutting. They don't like to go for haircuts. So again, we need to model, we need to show them from visual cards what hair cutting is. We need to model also, we need to show other people getting their hair cut. We need to explain it is important for the if the child is able to understand, if the child is in that stage, we need to explain them. It is important for the hygiene, why it is required, and then go ahead. So we need to create a plan for the child. So Abhisha, connect with me, give me more information about your child, the age and the concerns child has. Accordingly, I can develop a plan and I can give that plan to you, the steps which you can take, and that will help you with this. So children with autism get distressed with hair cutting. It is a normal phenomenon. You don't have to worry that it is not something very different. Many of us face this problem. But yes, with time, with slow exposure, children understand. They learn. Don't go for all haircut at one go. Show modeling helps a lot. Visuals, first visuals through visual cards, then modeling. Then let's cut somebody else's hair and expose the child. Let him see how the haircut is happening. What is the difference before haircut and after haircut? And it is not a painful process. Let them understand this. Then they will feel comfortable. And remember, children with autism find it difficult to relate that this activity is going to end. So sometimes they get distressed with hair cutting because the process is too lengthy and they feel it is going to go on forever. That, okay, this is my life now. Imagine if I tell you that this is your life, you have to sit in the class in this session forever, throughout your life. How distressed you will feel. That this session will continue and you are bound to sit here forcibly forever. There's no end to it. That's how children with autism feel distressed. So we need to show them, we need to go for smaller parts of haircut. We need to plan the strategies for that. Strategies in autism have to be individualized. So for each child, looking at first thing is with the context, the age of the child, concerns, areas of concern, sensitivity, all of this, we need to plan the strategy. And based upon the response of the child, we need to modify that strategy. So please connect with me individually. Give me the context, and then I will plan a strategy, give to you. You can follow that. And Then based upon the child, we will have to modify the strategy also based upon the response of the child. Most of us plan the strategy as per the context, as per the child situation, but we fail to read the response of the child. So with their expression, with their facial expressions, with their gestures, or if they are communicative with their words, we need to take the response. And on basis of response, we need to do modification. That's where the role of behavior modification comes in, the techniques, because we need to modify it. Whatever strategy we have planned for any learning, a goal plan, which we plan for next 3 months, and if the goal is going in the correct path, 99% cases, I feel we are failing. For any activity, for any behavior. If I write a goal plan for some behavior for 3 months and give it to my junior therapist, and if they are practicing it and I'm asking feedback after 15 days, a month, and they are saying, no, sir, we are going as per the plan, everything is smooth, then we are failing. Either the plan is too easy for the child, so we need to modify it, difficulty level needs to be increased so that the child can learn better. If we are going at par with the plan, that means we are failing. So we need to modify on the basis of response of the child, an individualized child. Each child will respond differently. So we need to read that response. Sometimes we feel comfortable. Okay, child is doing as per activity, as per things child is doing. We are doing tick marks. Okay, child is doing. But if child is able to do everything as per the goal plan, that means goal plan is too easy for the child. And we are doing a mistake. We need to make the difficulty level a little higher so that child learns faster. Okay, so we'll plan it out. No problems. I'm there to support you. Need not to worry. It is a common thing. Make a social story. It works. Yes, Sangeeta has mentioned it correctly. Make a social story, visual card, show it, and then model, show the real modeling, and then cut in steps. Don't cut all hair together. Go step by step with a shorter duration. With time, you may increase the duration. Start with 1 minute, 2 minutes, 3 minutes. After a month, you may reach to 10 minutes of duration. Look at the sitting span also of the child. Whether the child has sitting span, longer sitting duration, attention, like child can sit. If child is not able to sit for a longer duration also, that also is a distress for them that they need to sit at a chair to cut their hair for a longer time. So we need to work on that also. Reshma Swana says, thank you, sir. Thank you, Swana. Thank you so much. Reshma. Good evening, doctor. How to make a child to tell his name despite I repeat it 10 times. My son sometimes does not want to say his name. Other phrases he says independently, but some questions he still cannot give answer. First thing is whether your child, Reshma, is connecting with his name or not. Whether he knows that this is my name and I am supposed to say this, that is important. We need to work on that first. And then we need to also look into that he is answering independently some phrases, but some questions he cannot give answer. So whether he is understanding those questions, he is finding it difficult to understand the question. Because remember, input, process, output. We always expect output. But where is the difficulty? Difficulty usually in autism is not in output, but in input or process. So the chain which we have seen, so input we need to work on, whether the input is correct, then we need to work on processing, and then output will come. Okay. So you can connect with me, Reshma, individually, give me details of your child, and I can help you design the strategies which will help us to make him understand, make him say his name or answer the.
Yes, hello, doctor. Good evening. Rashma here.
But child is not able to
Okay.
use it in the day-to-day practice. Yes, Reshma?
Yes, I was telling that my child earlier he was able to say his name, but later on when he is growing up, then he stopped. When I question him, "What is your name?" Then he doesn't have any response. He just repeat after me, "What is your name?" And then when I say your name is Kian, for example, then he will say, "My name is Kian." That's all. But earlier, when he was younger, 3 old years, he could say his name. But later on, I don't know what happened. Then he cannot say his name on his own.
Okay. Okay. So I can relate it in positive and negative both ways. First, negative, is it a sign of regression? We have to do a detailed analysis of the child about the other areas also, whether the child is going into regression. Then we need to work very actively so that the regression stops there and we start with again learning. Okay. In autism, regression is very common. It can come at any stage, any age. But the positive,
Yes.
earlier child
Okay.
was positive is earlier child was maybe the child was only on imitation, only on copying and trained on what you say, what is your name? Child needs to say, my name is Kya. But now the brain processing has started. So child has started learning and understanding the question. And now child wants to process the answer, but finding it difficult to process the answer. So it could be with the brain processing
Okay.
in a positive way also. That child's brain is developing, and that's why the earlier child was just imitating, just replying. Child didn't know. We assume because he is just answering on the name, we assume that okay, child was answering his name. But probably it was like A,
Okay.
B after A. So child is like, okay,
Mhm.
A means what is your name? B means my name is Kyang. So B after A, child was just repeating it. But now, since child has started understanding the question, child is trying to, give you the answer, but child is not able to process the answer, finding it difficult and respond to. It could be either the ways. So we will have to do a detailed analysis of the situation. I am worried if it is regression. If it is cognition development, I am happy. But if it is regression, we need to act very immediately on it. So a detailed analysis of child's behavior, child's concerns, past concerns, and current development level, earlier development level, comparison of that will give us the answer. Okay.
Okay. In fact, he's very hyperactive, even at home. But it's only whenever I am around with him, because maybe he feels very comfort with me. That's why he's very hyperactive with me. But when he is at the carer's place, he's a very how do you say?
Calm,
He obey
thoughtful.
he listened to the lady.
Mm.
He is
So
very
that is common, Reshma. Our behavior is
yeah.
dependent on directly related to our environment. Environment makes
Mm-hmm.
of two parts. One is physical space, physical settings we are in. Another is people we are
Yeah.
in. Okay. So when you are there
Yes.
at an airport, or when you are there in a school, or when you are there in a clinic, your behavior automatically shifts, isn't it? When you are there with your friends, your behavior is
Yes.
different. When you are there with your husband,
Mm-hmm.
your behavior is different. When you are there with office colleagues, your behavior is different. So our behavior
Mm-hmm.
automatically shifts. The moment you enter in a school, your behavior shifts. The moment you enter in a party, your
Yeah.
behavior shifts.
He's
So
disciplined. Yes,
physical
he is
settings and people.
disciplined. Mm-hmm.
So child having different
Yeah.
behavior with you and different behavior with the school teacher is very common. It's normal. There is nothing abnormal in that. But
Okay.
yes, he exhibits hyperactive behavior with you. Now we need to
Mm-hmm.
learn how to work on this hyperactivity, not necessarily on the child,
Mm-hmm.
but on ourselves also. Sometimes it is in us. Child feels that we understand only the language of hyperactivity. That's why child is hyperactive with us. But with others, child is
Mm-hmm.
communicating in another language, other form of communication. Like with you, I'm
Yeah.
speaking in English. With somebody else, I may speak in Hindi. So with the caretaker, or the other place, child is speaking in the other language. With you, child is speaking another language. So you need to start understanding child's behavioral language. From there, you will be able to settle down. So it is not always with the child, but it is with us also. We should learn their behavioral language to modify their behavior.
Mhm. Yeah, in fact, we are Mauritian, so our language is Creole. But my son,
No,
he
no, no.
always speak in
I'm
English.
just, when I'm saying language, Reshma, I'm talking about behavioral language. Behavior is a
Ah,
language.
okay.
Okay. So I'm not
Yes.
saying Creole or French or English. I'm talking about the behavior. Child is communicating to
Okay.
you with his behavior through form of hyperactivity.
Uh-huh.
Child is
Yes.
communicating with a calm and settled behavior to the caregiver with different language. That is a different language. Calm and settled behavior or hyperactive behavior. These are two different languages, right? I'm saying
Okay.
that, not the Creole or French. So not the spoken word.
Yeah.
Behavior, I'm
Yes.
considering
This
it
I
as a language.
understand.
Yeah.
Mm-hmm. I
So why
understand this. So yeah.
So
Just
why
tell me.
child's behavior is different towards you? We need to again do an analysis, and on basis of analysis, we may reach to the conclusion. Maybe you need to make some changes in the environment, home environment, that is physical settings, as well as in the people, you. So if you make those changes, automatically behavior shifts.
Yeah, because in different he normally he goes in different places. So sometimes he stays at his grandmother's place, and then after working hours, when I return back, he come back to me. His father put discipline in him, but downstairs at his mother's grandmother's place, there is no discipline there. So the child is in different environment. That's why when he comes at our place, when his father is putting discipline with him, then he get hyper. He get very angry with his father. He speak. I don't deny. He can say phrases. Then he says to his father, "I'm angry with you. I'm angry." So I don't know how to control these behaviors sometimes because. He maybe sometimes he doesn't listen to us because he's too pampered at his grandmother's place.
Mhm.
That's the issue,
Okay.
and we
Okay.
cannot
So
regulate him. We cannot regulate him correctly. We cannot. It's coming a very tough. Um,
so you are from
it's very
Mauritius,
tough
if
for
I'm
us.
not wrong, right?
Sorry.
You are from Mauritius, correct?
Yeah, I'm from Mauritius.
And are you connected with Angel Special School there or not? I mean, different organization
Yes.
or Angel? Angel, right?
No. Yes, now he's going to a normal school. He's
Mhm.
okay at the normal school. He's
Okay.
disciplined. He understand his teachers also understand him. But
Okay.
now he will go now for an autism center where he will get all the occupational therapies and the speech therapy. The
Mhm. No
speech,
problem.
in fact,
So you just
he was
do one
following.
thing,
Yes.
Rishma. You just text me on WhatsApp, and then I
Mhm.
will we'll book an appointment. We'll do a detailed analysis of the child environment, and I'll give you the corrections what we can make in the environment to understand the behavior better. Let the child, because child is responding to the environment. Child's behavior is shifting
Yes.
with the environment.
He,
So
yeah,
I'll give you the list of corrections we need to make. Okay.
yes, because he has his grandfather. His grandfather is I don't know, he's an as obsession person because whenever he don't see my child, so he get irritated and he just pamper him a lot, giving
Mhm.
him a lot of toys, expensive toys and so on. So the child gets all these when he comes up to our place. We don't give him so much things to this interact him.
No problem.
But
Reshma,
sometimes
I will also do a detailed study of this behavior. So I'm requesting
yeah,
you again, please connect with me on WhatsApp. I've shared my number in the chat box. I'm again
yeah,
sharing it.
okay,
Connect with me on
yeah,
WhatsApp, and then we'll book an appointment. We'll discuss in detail. There I'll be able to
yes,
provide you the interventions. Okay?
yeah, thank you. Okay.
Okay. Thank you. Thank you, Reshma. So in such cases, we need to actually go in detail and then give the response. I mean, I cannot give generalized strategies for behavior shift. We need to first understand the behavior, situational behavior, and then work on it. So I'm resharing my contact number. Pooja also, I think Yeah, Poonam wanted the number of special educators. Poonam, connect with me on WhatsApp. I'll share it. I don't have by hearted right now. I'll share the contact details. Now, the next question I have from Pooja. Thank you, Ranjita. Thank you, Pooja, for your motivating words. Okay, my child has same problem with hair cutting, especially with vibration machine. If we use scissors, there won't be much problem. So definitely vibration machines means again the auditory system. So avoid vibrating machine, try to do that, or put the earplugs or noise cancellation earphones, noise cancellation headphones to the child before start the haircut. It will help you. Okay, next question from someone on iPhone that my child spits when he does not want to do the task. Avoidance. When he is excited and when he is tired. How to teach him? So again, the behavioral concern, we need to do a detailed behavior analysis of all the events whenever he spits, why he is spitting, because he is not spitting. Please understand. For you, it is spitting. For him, it is just a communication. I want your attention. I spit. I want to avoid this task. I'm not happy with this task. I don't want to do it anymore. I spit. So either for avoidance or for attention, child is doing. So when child is tired or excited or who does not want to do the task, child is spitting. So for child, it is not a bad behavior. For child, it is the behavioral communication that child has learned that by doing this, I get rid of the task. So whenever I want to get rid of the task, I just spit. Now we want to work on spitting. We want to teach the replacement behavior to the child. That if you want to get rid of the task, if you are tired, how should you communicate to me? Spitting is not the right communication. Alternative communication, replacement behavior strategies, alternative communication needs to be taught to the child. Okay. Through reward system act. Yes, Kolal, we can do the reward system also, but in my personal opinion, first we need to teach the replacement strategy also. Without the replacement strategy, reward system can just control the behavior for time being. Over the period of time, first thing is reward, you cannot continue forever. Second, over the period of time, you have to keep on changing rewards because otherwise it loses its impact. So my personal opinion, Kolal, you can unmute and speak on it if you have the other view. But my personal opinion here is that we need to give the alternative strategies first. Reward system can be a tool which we can use to support for the time being. Yes, you may unmute and speak. I would love to know.
Doctor, I want to say something about spitting.
Yes,
This child is for attention and he did not want to work. So all time he spit and spit. So how to work with him? It's really difficult for us.
That's what I'm saying. For attention, we know it
Yeah.
is either for attention or escape. There are two functions of the behavior for which we children spit.
Yeah.
So either for attention or escape.
Yeah.
Okay. So you give attention well in advance. You give shorter work. Make the activity more engaging and more interesting for the child, and teach the replacement behavior. That instead of spitting, once you are tired, you need to show this either through visual card or through gesture, or you start giving the breaks. Okay, activity
So
only for 2 minutes, like
we,
that. Start with shorter duration, with easier activity. Then child will not like to escape. Why child wants attention? Why child wants to escape? You need to first understand that. So do the ABC analysis, write down the behaviors when these behaviors are happening. So before, in those situations, wherever this spitting behavior is happening, start giving attention pre-hand. These are proactive strategies for behavior management. So pre-hand, you give the input. So you give the break to the child, or you give lesser difficult tasks, make the task more enjoyable for him, or give more attention to the child well in advance. So automatically spitting behavior reduces. And then teach the alternative communication, that whenever he is spitting, he is going to spit now. Once you read the behavior, at least for 10 days, 12 days, 15, 20 occurrence, you understand the behavior when it is going to happen. So when you know this behavior is going to happen now, in this situation, pre-hand, you give that support. attention or escape, whatever child wants. And then replacement. Replacement strategy needs to be taught.
Okay.
Okay, Sangeeta?
Thank you, Doctor.
Good evening, Dr. Alok. We
Yeah,
are
good
from
evening.
the same organization. We are talking about the same boy.
Same thing.
Yes, and he is spitting very frequently. It's very difficult to handle him, and teachers are very scared to teach him. We are scared because he is now 13 years old, and he knows, I think, whenever he doesn't want to sit there to learn, to when we want to teach him, he spits. When he is excited, he spits. When he wants to tangible, like when he wants to get something, he spits. We try to collect data, ABC also, but it's we cannot do anything, and we are hopeless what to do because he spits a lot. And
Okay.
and
Let us
he is
do one thing.
all the time he is free. I think we give him a water play. He likes to play with water, and most of the time he is free. Sometime we catch him being good, and we try to teach him, and he spits, and we are unable to teach him.
So
We
this
are
is
hopeless now.
so this is escape. He wants to escape from you. He wants to escape from your activities.
Yeah, sometimes he wants to come towards us, and he wants to touch us, and he's now being teenager, and he smells body of other people, and whenever he wants to go towards the people, he spits.
Okay. Do me a
People
favor.
are scared. Yeah.
Write the whole case history with the context, like child's history, development history, and the
Yeah.
context, what is happening right now in detail, and share
Yeah.
it with me on WhatsApp. I will plan the strategies and give to you. But
Thank
do
you.
mention,
Yeah.
make a list of at least 5 days behavior. In
Okay.
5 days, what time
Yeah.
he spit, what time he did not spit. Do
Okay.
not write your assumptions in it that he knows this or he does not know this. He is purposely doing it. All those assumptions we need to avoid. Just
Okay.
write down the situation.
All right.
That
All right.
today
Thank you.
morning this happened, and at this time he did spit, and then he was playing with water for 40 minutes. Then again he came and he started spitting on one teacher, and then again he went. When we brought him back to work to do this activity, which activity you are trying to do, that also you mentioned in that. Make a a
Yeah.
literature of 5 days, total
Okay.
5 days, and
All
share
right.
it. I will develop these strategies for you and share it
Thank
back to you, which you can
thank you
implement
so
with
much.
the improvement.
Okay.
On
Thank
basis
you
of
so
the
much.
response of the child, we will modify those strategies.
Okay.
Thank
Yeah.
you.
The behavior can be
Thank you.
managed. You don't have to worry. It is difficult because of the teenage. Also, hormonal
Yes.
changes are happening. So it
Yes.
is little difficult. Behavior is going towards the aggressiveness, but no problem. We can manage it. But
Thank
do
you so
write
much.
the case history, when this behavior started, how initially what was the frequency. Now is the frequency is increasing on day-to-day basis. Do write down all this. Take the inputs from parent also, whether he
Yeah.
is doing this behavior only with you or he's doing this behavior at home also. That is also very important.
Okay. Yeah.
Okay. So when
Yeah.
he goes to the garden in public places, whether he is exhibiting this behavior there, that is also very important. So all environments, just do a environmental analysis, write it down, share it with me. Let me go through the entire case. I will create the strategies and give. Okay.
Okay. Thank you, Dr. Alok. Thank you.
Thank you. Karishma says facing so many difficulties for her food intake. She is too picky. She wants only chips and noodles. It's getting really very difficult, especially at school. Karishma, how old is the child? Karishma Ganpat, if you are there, yes, I can see you. Please unmute. How old is the child? See, let us understand why picky eating happens. Picky eating happens because of number one, sensory issues. oral motor sensory issues. That is the first thing we need to eliminate. This one, chewing is not proper. Swallowing is not proper. So an oral motor assessment needs to be done to understand whether chewing is proper, the swallowing is proper, tongue movement is proper, the child is able to take it in intake properly and chew properly. Then sensory issues, that child is okay only with the one texture of. But here, since you have mentioned chips and noodles, two very different textures. Noodles, the soggy, soft texture, and chips, the hard, crunchy texture. So it is not more with, I believe it is not more with the sensory issue. So oral motor assessment, chewing and everything, we need to see chips, whether the child chews the chips and eats, or child keeps the chip in the mouth, makes it soggy, and then gulps it. That we need to look into. After phasing out this, then we need to look into what options we are giving to the child. What all other options are available to the child? Are we making eating a enjoyable activity for the child, or it is being done too strict way? That is also another concern. Sometimes we are making chips and noodles so frequently available to the child, because child is not eating other things, we just make, okay, at least eat something, so you eat chips. So is this happening? That also needs to be ruled out. Then we can reach to the conclusion why child is just eating. So picky eating is common in autism, but we can easily work on picky eating. There is no challenge on that. Okay. So Karishma, if you can unmute and give me the input, or you can connect with me separately, also one-to-one, I will give you the solution. Kulal, sir, what to do in autistic child who puts inedible things in mouth? That's called mouthing. Again, sensory issues, sensitivities in the mouth. So child puts everything in the mouth because child likes that texture. Child wants to feel that texture. The alternatives we need to provide, first of all, for mouthing. Chewing tubes, chewing candies, those are the alternatives. Then with the cognition level developing in the child, depending on the age of the child, we need to teach the child what is edible and what is not edible. What is okay to put in mouth, what is not okay to put in mouth. With the visuals, we can teach it very easily. So with the rewarding system, with the reinforcement also, we can teach the child. Okay, so start with giving alternative. Once the child has alternative, child will not do. Then this is edible, this is not edible. So what you need to put in the mouth, what you don't need to put. So sensory sensitivities are there in the mouth. That's why child is putting everything in the mouth. Shreya says, doctor, how to teach generalization in simple, understandable ways through activities? What generalization you want to teach? Just practice that generalization in different environments, different time schedules, different timetables, whatever you want to teach. It should not be limited to home environment, should not be limited to the school environment, or should not be limited to the therapy centers. So whatever skill you are teaching to the child, that should be taught in all environments: home, school, therapy center, and the playground. These are the four major environments for a child. Yes, what you are teaching, the concept remains the same. Activity may differ. The activity which you are doing in clinic or therapy center, not necessarily you will replicate that activity at home. But in your daily routine, you can incorporate the same goal with different activities. So you need to understand what we are teaching to the child, what are our goals, how we can incorporate them in a playground, in a school, or in the home environment. It will generalize. Otherwise, this common problem exists that child is doing everything in the clinic or in the therapy center, but when it comes to home, child is not doing. Be it behavior, be it the skills or activities. This is a very common concern. So you need to generalize all the learned skills or behavior needs to be generalized. Learnings also need to be generalized by giving options to the child. Now I teach the child to drink water. Okay. Drink water in a tumbler. But I need to generalize it to drink water in a saucer, to drink water in a cup, to drink water in something else. then only this skill which child has learned is generalized. To eat food in a plate, to eat food from a bowl, we need to generalize. So give options to the child, different options at home, that will generalize. Your child sleeps every day on the bed, double bed with you, or on his own bed in the left hand side. Some days child needs to sleep on the right hand side. Some days head is this side. It's okay to have head on the other side. Generalize. Generalize everything, but slowly. Okay. So the child will learn generalization in life. Otherwise, what will happen? Child will grow, become adolescent or adult. When the child will go out of the home environment, in the home environment, you can give everything perfect as per standard or child preferences. But something is missing in the outer environment. Like child has to travel by train sometimes. Child has to sleep, a sleeper train in India. So child has to sleep on the berths. Child will feel uncomfortable, child will not sleep whole night, and it will become a miserable journey for you. Child may get into meltdown also. So if you generalize the child, it's okay to sleep on sofa sometime. Child will learn to sleep on sleeper also. So we need to generalize behavior, generalize activities or skills child learns, and generalize in generalization. ADLs is also very, very important. Activities of daily living. Sometimes we fail to generalize ADLs. We are happy if a child is doing his own daily activities. But generalization part is missing. So that is also very important because child has to grow up, has to go out in the world. Thank you so much. Thank you, Pooja. Okay, Karishma says 4 years old child. Thank you, doctor. Yes, Karishma, I've given you the inputs on picky eating, but further you may discuss with me. I will definitely help you out because we need to discuss and try different strategies. I'll rule out the possibilities one by one. Do the Oreo motor assessment also. Rule out the possibilities of difficulties the child is facing. Remember, whenever it comes to behavior, first of all, look into the physical constraints. Some behaviors are because of my physical limitations. Because physical limitations are easiest to work on. So first we need to look on the physical, then look on the sensory, and then come on the behavior, registered pattern. First approach should be physical concerns. Second approach should be sensory issues because sensory behaviors are very common in autism. And third approach, third step is the cognition part, the processing part, or the registered behaviors. That needs to be the patterns that have been developed. That needs to be unregistered and new patterns we need to develop. So new patterns means replacement. So replacement strategies also are equally important. We need to teach them. Shreya says, doctors, things like eating food, drinking drinks, and playing toys. Thank you. I didn't understand, Shreya. Is it in continuation to your last question? Let me go back and see. Okay, there is an input. Yes. So what was the last question? I have to go back, Shreya. Just how to teach generalization. Yes, yes. Things like eating food, drinking drinks, playing toys, doing daily activities, whatever skills I'm learning, generalization, whatever behaviors I'm learning, that generalization is also important. If I'm saying thank you to you, generalization, that I should say thank you to others. I should say thank you in which situations I should use word thank you. Where all I should use word sorry. Everything needs to be generalized because generalization is the major part which is absent or missing in autism. So it has to be in all areas, skills or in the activities or in the behavior. All three areas generalization is important. Thank you. Okay, any more questions, anyone? If not, then we can end up the session for today. I have already mentioned twice my contact number. You can WhatsApp me, people who are there already in the WhatsApp group. You shall get this recording as well as the PPT which I have shared today in the WhatsApp group. I also have some reading material this week. I'll be sharing it with you. Thank you. Thank you so much. Thank you, Mary.
Thank you,
Glad
Dr.
to see
Aldo.
you. Thank you, sir. Thank you, Bobby. Nice to see you. Thanks. Bye-bye.
Bye-bye.
Thanks, everyone. Thank you.